National Data Archive on Child Abuse and Neglect. Conducting your research using NYTD, National Youth in Transition Database. The Chafee Foster Care Independence Program, CFCIP, provides states with grants to support programs for transitioning youth to adulthood. The program is intended to serve youth who are likely to remain in foster care until age 18, or who were adopted after age 16, or who have aged out of foster care. Age of eligibility for Chafee services varies by state. The purpose of Chafee services is to help current and former foster care youth achieve self-sufficiency. Relationship between the Chafee program and NYTD. The law that created the Chafee program also included funds for collecting data that will allow researchers to learn more about foster youth in transition to adulthood and to assess the efficacy of the program. NYTD is the National Youth in Transition Database, the data collected under the program. There are two kinds of data in NYTD: data for tracking services and data from a survey to assess youth outcomes. Overview of data in NYTD. The services file contains a record for each child who received one or more services during a 6-month period. It is cumulative data from federal fiscal years 2011 through 2015. The outcomes file contains results of surveys conducted with a single cohort of foster care youth to examine well-being, financial, and educational outcomes at 3 intervals or waves. There are currently 2 cohorts with the following data. Cohort 1 contains youths age 17 during fiscal year 2011 with waves 1, 2, and 3. Cohort 2 contains youths age 17 during fiscal year 2014 with a wave 1. NYTD, the services file. Starting with fiscal year 2011, the services file contains semi-annual data on all youth, regardless of their foster care status and age, who receive at least one of 14 independent living skills services paid for or provided by a Chafee-funded county or agency. The data on the 14 independent living skills services include academic support, career preparation, supervised independent living, health education, and home management training, etc. The variable rep date, REPDATE, provides the specific 6-month period in which services were provided. Periods are based on federal fiscal years, October 1st through September 30th. Period A is the first half of the federal fiscal year, October 1st through March 31st. Period B is the second half of the federal fiscal year, April 1st through September 30th. Wave data in the outcomes file. There are 3 waves of outcome data for a given cohort: a baseline survey during the year of the youth's 17th birthday and 2 follow-ups, one at age 19, one at age 21. Wave 1. All youth who reach age 17 in the baseline fiscal year are in the baseline population. Those who respond to the survey are in the cohort. The Wave 1 data file includes demographic data for all youth in the baseline population, regardless of whether they respond to the survey. Wave 2 is the 2-year follow-up given to youth in the cohort during their 19th year of age. States have the option of surveying just a sample of the youth who responded to the Wave 1 survey. Because of sampling, some youth who responded to the baseline survey will not be asked to do the follow-up surveys. Wave 3, the 4-year follow-up, is given to youth in the cohort at age 21. States that sampled for Wave 2 will use the same sample for Wave 3. They do not resample. It is not necessary to have responded to the age 19 survey to be eligible for the age 21 survey. Schedule of cohorts and waves for the NYTD Outcomes Surveys. Cohort 1 is age 17 in 2011, with Wave 1 fiscal year 2011, Wave 2 fiscal year 2013, Wave 3 fiscal year 2015. Cohort 2 is age 17 in 2014, with Wave 1 fiscal year 2014, Wave 2 fiscal year 2016, Wave 3, fiscal year 2018. Cohort 3 is age 17 in 2017, with Wave 1 fiscal year 2017, Wave 2 fiscal year 2019, Wave 3 fiscal year 2021. This graphic illustrates 3 cohorts, but surveys will continue beyond Cohort 3. A new cohort will begin every 3 years. Each cohort has 3 waves. Waves with a green background are completed and available from NDACAN. That is Cohort 1, Waves 1, 2, and 3, and Cohort 2, Wave 1. It is not necessary to have all 3 waves of the survey in order to analyze the data. Linking NIDed to other datasets. Rec number is an encrypted version of the child's identifier in the state's administrative data. This child ID can be used to link the outcomes and services files. ST is the 2-character state postal code, NY for New York, etc. Use the combination of the variables ST and rec number to link the services and outcomes files with the following files and their respective variables. Adoption and Foster Care Reporting System, AFCAR's foster care file, ST plus rec number. National Child Abuse and Neglect Data System, NCAN's child file, STATERR plus AFCARSID. The AFCARS and NCAN's datasets are also available from www.ndacan.acf.hhs.gov. This concludes our video tutorial on the NIDed data. Please email us if you have any questions. The email address is ndacansupport@cornell.edu. The National Data Archive on Child Abuse and Neglect is a project of the Bronfenbrenner Center for Translational Research at Cornell University. Funding for NDACAN is provided by the Children's Bureau.